Thank you very much. And to Scutch and to Rich, thank you for being here and for talking about the work of your members. And Scutch, thank you for inviting me to respond to Rich's comments. I would have to say, as Rich mentioned, that four of us got together a number of weeks ago to talk about issues that we had in common and to talk about shared visions that we have. And the message that Rich presented today about working collaboratively with one another and to focus on what we can be doing together with a shared vision and a shared set of outcomes is exactly the nature of the conversation that we had in that smaller group as well. I think that there is no question about the fact from the local public health department perspective and from the perspective of NACCHO that we are in a very different place today than we were even just a few years ago. The financial and legal pressures that are on us all, regardless of the nature of the department in which we work or the community in which we work, are profound right now. And some might even say that we are at the end of an era in the practice of creating a healthier community in all the forms in which that has been done in the past. And I would agree, certainly, Rich, that there is no room for professional hubris at this point. We do share vision, and we do seek in the same kinds of ways to prevent disease and to promote health and to prepare our communities for day-to-day life and equity and also to improve population health. And we certainly share an interest in having sufficient resources to get our respective work done and in having the information technology and the shared information technology and the data to perform our important and respective roles. And certainly the work that's been demonstrated at the conference here suggests in the importance of research to understand what works on the public health practice side and what kinds of important models and lessons can be shared within the public health community and can be shared much more broadly too. While there has been a lot of focus on the Affordable Care Act and in particular on the community benefit portion of the Affordable Care Act, I think what's important is to understand the historical context, which is this has been an ongoing conversation really for about 60 years, and that we're just in another phase of having a conversation. And in any kind of conversation, the challenge is simply to talk with one another and to see what's shared, and that there is a lot shared. Nonprofit hospitals, I think, and certainly local health departments are sensing from the environment that the traditional service models aren't sustainable in the current form, and that the importance of recognizing prevention and the overlap that nonprofit hospitals and local health departments have in this very important area is, as Rich described, important to address the epidemic and create actually the epidemic of health that we actually want. And we need both of these very important types of organizations, in this case local health departments, Paul, I'm sure, and I agree, will say state health departments too, these three kinds of organizations, governmental public health organizations, nonprofit organizations like hospitals, and a range of other community organizations as well. We actually share, if you sit down and think about the respective roles of the different organizations, complementary and supplementary assets. And if we thought carefully and worked carefully with one another in each community to understand what those assets are, as variable as they are among nonprofit hospitals and among local health departments, we would begin to reinforce the very interesting and specific work that we each could be doing. I think that this isn't a time, and I think that the comments that Rich has made suggest to us that from the hospital side, it isn't a time to hunker down, which is one reaction to being under stress, to kind of shut the doors and sit and hope that the disaster goes away. It really is a time to throw open the doors, and whether you're a local health official or a hospital CEO, it's really time to walk across the street or go down the hall or do whatever you need to do. Simply say, I'm here, I recognize that we need to be working together, and if the introductions haven't been made before, to make those recommendations, as I think our associations are attempting to do. The good news is that this kind of work has been underway for a long time. And frankly, what we need to do is to hold up the examples of what I've called in other circumstances positive deviance. It's easy to find the places where things aren't working well, but all across the country right now, not because of any change in law and not because of any change in circumstances, there are very good examples of hospitals and local health departments and state health departments that have discovered their systemness and the reasons for working together. In Palm Beach County, Florida, in Independence, Missouri, in Norwalk, Connecticut, in St. Clair County, Illinois, in East Central Nebraska, in some of our biggest cities, despite the broad variation in the way in which those communities are structured, people have been figuring this out for a long time. And I think that the methods that they're using, we could be cynical and say that, you know, somebody only wants a checkoff list, and that's all they're interested in. But the evidence from the places where this is going on is an understanding that process is very important, that there are good reasons to share these common goals, and there are good reasons to construct an ongoing process to make sure that on an ongoing basis these conversations take place, that the same kinds of metrics are being used to understand how change is happening in a community, and that the quality improvement techniques and culture that are in evidence in our hospitals and in evidence in our local health departments are used here too, to understand whether the processes that we're using and the outcomes that we're getting are in fact the ones that we should be using and the outcomes that we want. And if they're not to beat each other over the head about it, but to say, okay, we discovered something. This doesn't work. Clearly, if we look at health status and equity across the United States right now, this isn't working. And so what we need to do is not just do more of the same thing. We've got to do something different and simply say, it's not working, let's do something different. I think that there are, from the association perspective, there are a number of things that we can and should be doing, and I'm hopeful that the conversations that we've started will in fact continue. I think we can, as I mentioned earlier, identify the positive deviants and hold them up to say to those who are skeptical this work can't be done, that in fact it can be done, and your own colleagues are doing it. So adapt the methods and the processes that your colleagues have used and use them in your own community. Hold them up as examples to emulate. We can share materials that each of our associations are developing because we each have them. And we should be sharing them with one another, and we should be going to each other's meetings and talking about what we're doing collaboratively and holding up the good examples of what's done. We should be organizing webinars because everybody can't get to a conference, and doing that collectively to demonstrate our leadership for our own membership, that these are important. This is important work to be doing. And I think to end, we should look at the recent report that was issued by the Institute of Medicine for primary care and public health. And what did that report tell us about what's necessary? It told us about what's necessary for public health and for primary care. But the instruction in there is suggestive of what's important for anybody who's interested in the shared goal of population improvement, which we are. First is community engagement. The second is aligned leadership. The third is sustainability. And the fourth is data and analysis. And I'm hopeful that what we're able to do association-wise is to take those characteristics of success, more broadly share them with our own respective communities, and encourage more of that to be happening in communities nationwide. And I'm willing to bet that if we do that, we will change the systems that we have, we will change the processes that we use, and we will get better health outcomes in more places and a more equitable society than we currently have right now. Thanks.